sometimes you may be wondering, yes, I do see my period twice in a month. Why is it that my own friend used to see her own period once in a month? What is the problem? Okay, I will tell you. From puberty stage, some will always see their menses once in a month, while some others will always see it twice in a month. If you are seeing your menses once in a month, that means you have a longer cycle. But if you are seeing your menses twice in a month, that means you have a shorter cycle. Those who have a longer cycle will always experience their menstrual cycle within 28 days, 29 days, or even 30 days. Okay, but those who have a shorter cycle will always try to see their menses within 22 days, 23 days, 24 days, or even 25 days. So, if from the puberty stage you begin to see your menses once in a month, and then all of a sudden it changes to you yourself see your menses twice in a month, that is when you should meet your doctor. If, for instance, you have been seeing your menses twice in a month right from your puberty stage, then you should take it that it is how your own system works. You should relax your mind. There are some things that may make you to begin to see your period twice in a month. What are those things? The first is endometriosis. What is this endometriosis? Endometriosis is when the tissues that are supposed to form at the lining of your uterus leaves that particular place and then go to another place to begin to form, like begin to form at the ovaries and then at the fallopian tube. Then you know you are suffering from endometriosis. And then there is a possibility that this endometriosis can make you to see your periods twice in a month. Endometriosis can happen to any woman at any age at all. Another is menopause. When you get to the age of menopause, so many things begin to change in your body. You may experience having your periods twice in a month. You may experience having your periods once in 2 months. Okay? So, when you get to the age of menopause, for some persons, you may experience it from your middle 30s, early 40s, early 50s, and so on. So, whenever your own menopause begins to occur, that is how your own system runs. So, you should accept it that way. The signs of perimenopause may bring about you yourself seeing your menstrual cycle to occur twice in a month. Another is thyroid problem. Thyroid gland is a butterfly gland that is found at the neck. This thyroid gland controls the metabolic activities like controlling your temperature. Okay? So, thyroid gland is a gland that produces a hormone known as thyroxine. If you lack this hormone in your body, you can feed on bones of fish so that you can get the thyroxine from there. As a lady, if you should have a problem with your menstrual flow, then you may try to know whether some hormones that are responsible for your menstruation, like the luteinizing hormone, the follicle hormone, and then the estrogen and progesterone, if they are not in order, they can bring about an irregular menstrual cycle. Then you begin to see your periods twice in a month. Another is uterine fibroid. Uterine fibroid will as well make a lady to be seeing her menses twice in a month. Now, if a lady should be suffering from uterine fibroid alongside with this having her menses twice in a month, it may result to the following. She may be experiencing a feeling of fullness in her abdomen. There may be some pressures at her pelvis. Then she may be experiencing frequent urination. Another is pain during and after sex. So if a lady is experiencing all these things, she is advised to meet her doctor for urgent treatment. If not, she will continue to experience this twice in a month menstrual flow. Another is pregnancy. Pregnancy can make some women to begin to see their menses twice in a month. How? Is it possible that someone can see her menses while being pregnant? Okay, you may not call it completely pregnancy, because spotting, which can occur as a result of having some fluid like pink fluid or dark brown fluid flowing out of your vagina. Now, this can take place within the first trimester of your pregnancy. So, if you should see all this, you may not have to be panicking. What you have to do is to report to your doctor. But it is not actually a problem, because this is something that can disappear after the first 3 months of your pregnancy. So it may alter your menstrual flow, and then you begin to see your menstrual cycle twice in a month. But this is not general. It happens to some women, and then some others do not experience it. This flow as well can be as a result of heavy stress or even sex. Yes, for some people whom their partners will give them a heavy sex, or who may experience heavy stress, they may begin to experience this spotting or pink or dark brown flow from their vagina. Stress can as well alter your menses. It can make your menses to be delayed. It can make your menses to come twice in a month for some women. So as a woman, once you know that your time for menstrual cycle is approaching, please reduce stress. Another is emergency taking of contraceptive pills. Some pills can contribute to you yourself seeing your menses twice in a month, because these pills can as well bring about an irregular menstrual cycle. That is when the pills have distracted the hormones that are responsible for your menses. We know that there are 2 glands that control your menstrual cycle, the pituitary gland and then the hypothalamus. These 2 glands produce the hormones that do control your menstrual cycle, which are the luteinizing hormone, the follicle hormone, and then the female sex hormones, where we have the estrogen and progesterone. So if you should take a pill that has to alter the function of all these hormones, then you are likely to have your menstruation altered, thereby seeing your menses twice in a month. Another is when you skip or when you discontinue a family planning method. This can as well give you a chance of seeing your menses twice in a month. Okay, so if you are in a family planning method, you try to know what to do. If the doctor should ask you not to skip any of the methods, please don't skip, and then try not to discontinue the methods, because if you do, this will as well contribute to you yourself seeing your menses twice in a month. Another is that vaginal or cervical infections can as well contribute to you yourself seeing your menses twice in a month. So if you should have a vaginal or cervical infection, please try and meet your doctor for an urgent treatment. If not, this will bring about a hormonal imbalance, and you know hormonal imbalance can as well contribute to you yourself seeing your menses twice in a month. Okay, having heard all these things, you can now know that for your friend to be seeing her menses once in a month and you yourself seeing your menses twice in a month, there are some causes. Okay, so if you should see your menses once in a month, you know you have a longer cycle. If you should see your menses twice in a month, you know you have a shorter cycle. Bye.